What is TB?
Tuberculosis is a disease that is caused by the bacteria Mycobacterium tuberculosis, and it is a disease which affects mainly the lungs, but it also affects other parts of the body, including kidneys, the brain, and the bones as well.
TB cases may be dropping in the U.S., but there's still a serious problem in the Pacific Islands, where rates are nearly 10 times higher than the U.S. As of 2004, Palau showed a rate 5 times higher than the U.S., and Guam was 6 times as great. Other Pacific islands showed even higher rates. The Commonwealth of the Northern Marianas and FSM were 14 times higher, and the Marshalls was higher still, at 15 times the U.S. rate. TB has become a major health problem in the Pacific, along with diabetes and heart disease. The germ spreads through the air from one person to another. When a person with active TB of the lungs or throat coughs or sneezes, the bacteria are sprayed into the air. People nearby may breathe in these bacteria and become infected. When a person breathes in TB bacteria, the germs can settle in the lungs and begin to grow. The germs can also move through the blood to other parts of the body, such as a kidney, spine, and brain. People with active TB disease are most likely to spread it to people they spend time with every day, family members, friends, and co-workers. Latent TB infection is a condition in which tuberculosis bacteria are alive, but inactive in the body. People with latent TB infection have no symptoms. They don't feel sick and cannot spread TB to others. But they can show a positive reaction to a skin test. In most people who breathe in TB bacteria and become infected, the body is able to fight off the bacteria to stop them from growing. Many people who have TB infection never develop TB disease. In these people, the TB bacteria remain inactive for a lifetime without causing disease. But in 5 to 10% of people infected, especially people who have weak immune systems, the bacteria may cause TB disease. Active TB disease is an illness in which TB bacteria are multiplying and may attack different parts of the body, making a person feel sick. Active TB is also the only form of TB that can spread to others. People with weak immune systems are vulnerable to developing TB disease. These include babies and young children, people suffering from other diseases, diabetes, kidney disease for instance, and people infected with HIV. TB bacteria usually grow in the lungs, and this might result in symptoms such as a productive cough that lasts 3 weeks or longer, pain in the chest, or coughing up blood. Other symptoms of TB are weakness or fatigue, unexplained loss of weight, swollen lymph glands, no appetite, chills, fever, or sweating at night. Who should get tested for TB? You should get tested for TB if you experience the symptoms of TB disease and you know you have spent time with a person who has TB disease. Testing for TB can be done at the local public health clinic, your local doctor, or with a TB specialist. Testing includes one or more of the following: skin test, sputum sample, chest x-ray. Testing is available at your public health clinic, and it's free for the public. TB can be treated and almost always cured with medicine. But it is very important that you take your medicine exactly as a doctor or nurse tells you. If you have active TB, taking 2 or more medications will be necessary to kill all the bacteria and to prevent them from becoming resistant to the medicine. If you have active TB disease of the lungs, you are considered infectious. And you need to stay home from work or school so that you don't spread TB bacteria to other people. After taking your medicine for a few weeks, you will feel better, and you may no longer be infectious to others. Your doctor or nurse will tell you when you can return to work or school or visit with friends. When you are no longer infectious or feeling sick, you can do the same things you did before you had TB disease. Having had TB disease should not stop you from leading a normal life. The medicine that you are taking should not affect your strength, sexual function, or ability to work. If you take your medicine as your doctor or nurse tells you, the medicine will kill all the TB bacteria. Treatment for TB disease always requires follow-up visits to the healthcare provider who will evaluate your progress. Follow-up laboratory tests and chest x-rays are ordered. Remember, it's your responsibility to keep all medical appointments and to stay on treatment. If you have TB disease, you must take your medicine regularly. If you stop taking the medicine too soon, the TB bacteria will grow again, and you will once again become sick with the disease. You will have to start medication all over again. But you will become infectious again if you go off the medications, and this time it could be much harder to get rid of the disease, since the TB bacteria may become resistant to the medicine. In such a case, you may come down with an incurable form of this contagious disease, which would threaten the health of everyone around you. For this reason, it is absolutely critical that you take the medications in exactly the way your doctor has instructed, and that you do not miss doses. Occasionally, the medicines may cause side effects. If you experience symptoms such as nausea, fever, abdominal pain, dizziness, loss of appetite, blurred vision, or hearing loss, call your doctor immediately.
How do I remember to take my medicine?
Your doctor may schedule a healthcare worker to regularly meet with you when you need to take your medications. This is called Directly Observed Therapy, or DOT. Get into a routine. take your pills at the same time every day. For example, you can take them before eating breakfast, during a coffee break, or after brushing your teeth. Ask a family member or friend to remind you to take your pills. Mark off each day on a calendar as you take your medicine. Keep it by your bed or in your purse or pocket. The most important way to keep from spreading TB is to take all your medicine exactly as directed by your doctor or nurse. You will also need to keep all of your clinic appointments. Your doctor or nurse needs to see how you are doing. You may need another chest x-ray or a test of the phlegm you may cough up. These tests will show whether the medicine is working. They will also show whether you can still give TB bacteria to others. If you are infectious while you're at home, there are certain things you can do to protect yourself and others near you. Your doctor may tell you to follow these guidelines to protect yourself and others. Always cover your mouth with a tissue when you cough, sneeze, or laugh. Put the tissue in a closed bag and throw it away. The doctor will advise you when you may safely return to school or work. Stay in a well-ventilated room. Remember that TB is spread through the air. People cannot get infected through handshakes, sitting on toilet seats, or sharing dishes and utensils with someone who has TB. TB has become far too common among Pacific Islanders today. Not just those living at home on the islands, but even those who have gone abroad to live in the U.S. Do yourself, your family, and your friends a favor. Help eliminate this disease. If you think that you're at risk, go to the hospital and get yourself tested for TB.